Hi everybody, my name is Komal and I'm a dentist here at Locala. In this short video, I will share some top tips to help keep your child or young person's teeth and mouth healthy, to prevent tooth decay and to help make toothbrushing easier. So, to prevent tooth decay, we need to limit sugar in our child or young person's diet and try to brush properly. This is the key to preventing tooth decay and keeping teeth strong and healthy. Let's start with toothbrushing. We know that brushing can be difficult for parents of autistic children, young people, or those with learning disabilities. So I will share my top tips today to make this easy for you. Some autistic children or young people prefer routines, and it can be stressful when this routine changes. Try to make brushing part of their daily schedule and incorporate toothbrushing into a routine. The most important time to brush is before bedtime. This is because saliva levels are very low when your child or young person is sleeping, and saliva is really important to protect our teeth from decay, so we need extra protection throughout the night. Fluoride in the toothpaste is the good stuff, so brushing before bedtime leaves fluoride on the teeth throughout the night, giving teeth the extra protection. Try to make bedtime brushing part of your child or young person's routine. Remember to also brush one more time during the day. It's important that we all brush our teeth at least twice a day. Some autistic children or young people do not like the strong, minty taste of toothpaste, and this can be a real barrier for some parents or carers to overcome. A specially designed toothpaste called Oral Nurse was developed for this reason. For children or young people who don't like the taste of minty toothpaste or even water, Oral Nurse does not foam and there is no flavour. It is widely available online and in shops, and we'll attach a link to this video. It's really important that you use a pea-sized amount of toothpaste for children over the age of 3, containing at least 1450 parts per million of fluoride. Now, most family toothpaste found in shops contain this amount of fluoride. To find the fluoride levels, look on the side of the toothpaste box. We recommend that after brushing, there is no rinsing. Spit, do not rinse is something we commonly say to our patients. This keeps the fluoride on the teeth for the extra protection, so please get your child or young person to spit out all of the toothpaste, wipe their face afterwards, but no rinsing. Remember, fluoride is the good stuff. We recommend brushing for at least 2 minutes. Make brushing fun, whether your child or young person has a favourite YouTube video that takes 2 minutes, a favourite song, or a favourite timer. Whatever works, just use it. We recommend spending 1 minute on the top teeth and another minute on the bottom teeth. Now, it can be difficult for children or young people with learning disabilities to hold the toothbrush at the correct angle. For this reason, a special toothbrush was developed with these children or young people in mind. The Dr. Barman's Super Brush cleans all sides of the teeth at once with a simple backwards and forwards brushing action. The soft outer bristles are angled to gently clean along the gum, while the inner bristles clean and polish the tooth surface. This means that all surfaces can be cleaned with one stroke. Here is a link on Amazon. So we have 3 brushes here that I'm going to demonstrate for you now. The first toothbrush is a manual toothbrush. The second toothbrush is a super brush, and the third toothbrush is a Dr. Barman's brush. So we'll start off with a manual toothbrush. With a manual brush, you want to aim the bristles of the toothbrush at the gum line at around about a 45-degree angle, and ensure you're doing small circular motions like this. It's also really important that you angle the brush at the gum line and flick upwards for bottom teeth and downwards for top teeth, so that we're getting rid of all of the bacteria that's on our gums and our teeth. Now, for patients that really struggle to get the angle right with a manual brush, this is where the Dr. Barman's brush comes in. So, to use a Dr. Barman's brush, we engage the toothbrush on the biting surface of the tooth. The outer bristles clean the outer gum line and the outer parts of the tooth, and the inside bristles sort of just clean the inside of the tooth. And the good thing about a Dr. Barman's brush is that in one sweeping action like this, all the teeth are cleaned. A super brush is very similar to a Dr. Barman's brush. It's a little bit bigger and thicker, so we recommend this to be used for older children and young adults. So with an electric toothbrush, it's really important to know that you've got to hold the toothbrush on each tooth surface just for a few seconds. You don't need to move the brush because the bristles automatically rotate. This can make it a lot easier for your child or young person. The second part of this video focuses on the importance of diet for good oral health. Eating the right food really helps keep teeth healthy. Too much sugar can cause tooth decay, so it's important to limit sugary foods and drinks. Sugary foods and drinks can cause tooth decay if we have them too often. Keep them to a minimum, and if you do give them, the best time is straight after a meal, so there will be less sugar attacks on your child's or young person's teeth. Every time we eat something containing sugar, the bacteria in our mouths turns the sugar into acid, and this attacks our teeth. If this is not cleaned properly, a cavity can start to form. Avoiding sugar between meals helps to allow your child's or young person's teeth to repair after a sugar attack. The more often your child or young person has sugary foods or drinks, the more likely they are to have tooth decay. Children or young people do not need sugary snacks and drinks. If you really want to give your child or young person a snack, try to stick to alternatives such as cheese, vegetables, fruit, or even plain breadsticks, plain crackers, or fingers of toast. The only drink between meals should be plain water. Also, check that any medicines your child or young person takes are sugar-free. The NHS Food Scanner app is a great tool to help check salt, sugar and fat in foods when you're shopping to help you make healthier choices. Some food and drink packaging use a traffic light system, making it easier to choose low sugar choices. Choose more foods with green labels for lower sugar. So children aged between 4 and 7 should have no more than 19 grams of sugar per day. That's about 4 teaspoons. It is recommended to avoid sugary drinks and limit food with added sugar. So here is a sugar board with a few examples of foods and drinks targeted at young children and a rough estimate of the value of sugar that they hold. So to summarise, I will now give you my top tips. Firstly, brush children's or young person's teeth twice a day, especially at bedtime. Use Oranus or Dr. Barman's to help with your child or young person's needs. Remember, spit and do not rinse. Fluoride is the good stuff. Avoid sugar where possible and limit this to meal times only. Register with a dentist and visit them on a regular basis. It's also really important to avoid bottles after your child's first birthday. Now that's everything from me today. I hope this video will give you the tools that you need to keep your child's teeth strong and healthy and to help you make better choices to fight against tooth decay. And remember, spit and do not rinse. Fluoride is the good stuff. Thank you for watching.